I can't go out, but I can look back.
Good evening.
Searching for some parallel against which to set these extraordinary times has enabled me to trawl through nearly 5 decades of my life as a reporter. Thanks to the Channel 4 News and ITN archives, I can invite you to join me in trying to make sense of what has brought us to this time. From SARS and MERS to AIDS and Ebola, I've had to report on a number of global health crises in my time. The world has lived with the threat of a pandemic for years. Smallpox and polio, but 2 of many affecting our own island state. But we have never endured the full-scale eruption of one that affected the whole world at once. I'm Jon Snow, and this is what I know and what I've learnt after nearly 50 years of reporting the news. History in the making, all over the world. In the 1980s and 90s, we reported on the horror of the AIDS crisis, which became one of the deadliest and most persistent pandemics humanity has ever seen. Not only is this a devastating and utterly terrifying illness for all those affected, it also, at the time, led to the further discrimination of minority groups and decimated some of the poorest and most vulnerable people and places on Earth. Yet, it was only when AIDS overwhelmed the gay community in New York that many really understood the true global threat of the disease. But it was Africa's agony that sealed the need for a truly global effort to combat AIDS.
This is a country where the old bury the young. AIDS has seeped through Botswana like poison. It started in the towns, but now it's everywhere, in the rural areas, in the country's biggest village, Molopolole.
Botswana had such high hopes. The government was going to spend the diamond revenues on ending poverty and developing the rural areas. But now it's going to have to devote more and more of its budget to hospitals and medicines.
The people, meanwhile, spend their money on funerals and tombstones. AIDS is making everyone poorer. It's changed everything.
In 1998, to mark World AIDS Day, I interviewed a photographer who witnessed firsthand the horrifying effects of AIDS in Africa. The pictures are distressing, offering a profound insight into a desperate battle that persists in Africa to this day.
In a way, it's a kind of slow-burning holocaust. I mean, it's an immense decimation of a large proportion of Africa's most productive people, happening in a very slow and often invisible way. She began to lift him, and while I was photographing, he had a spasm and died from AIDS-related kidney failure. On my contact sheet, I can follow him going from life to death. Is quite disturbing and something which happens in Africa, many, many times every day.
Even such prominent figures as South Africa's Thabo Mbeki continued to deny the science enshrined in the AIDS epidemic.
It seemed to me that we could not blame everything on a single virus.
Perhaps surprisingly, it was President George Bush who launched Plan for Africa, which was to plough billions of dollars into fighting AIDS. Here in the UK in the mid-1980s, BSE or mad cow disease struck, ravaging agriculture in Britain and the world beyond. But it wasn't until the mid-90s that it was thought to be the cause of a new strain of the fatal degenerative brain disorder, Creutzfeldt-Jakob's disease. The government denied it for years, which some thought as mad as the disease itself.
More than 2,000 cattle on hundreds of farms have been incinerated, their meat too contaminated with bovine spongiform encephalopathy for human consumption.
There we are. I think that's like
It all had a familiar ring. Yet another agriculture minister at a photo call trying to allay public fears about the safety of British beef. It seems that all attempts by ministers to calm fears about food misfire, most notoriously when John Gummer gave his daughter a beef burger to eat.
Peter Hall died of CJD, Creutzfeldt-Jakob disease, last month. He was 20. It's the recent appearance of this disease in young people that's causing serious concern. Researchers at this laboratory in Edinburgh found that 10 of the victims of CJD, all under 40, were suffering from a new strain of the disease, and it may be connected with BSE.
There remains no scientific proof that BSE can be transmitted to man by beef, but the committee have concluded that the most likely explanation at present is that these cases are linked to exposure to BSE.
Let me put it to you, Minister, and it's painful to put it to you like this, that we are now tonight facing the consequences of a completely inadequate response to BSE.
I don't agree with that.
The call for a public inquiry comes from one of the world's leading neuroscientists. Professor Colin Blakemore is accusing Conservative ministers of selecting the advice they wanted to hear, that beef was safe, and ignoring the warnings.
The key to the whole 16 volumes of the Phillips report into the crisis is in this one paragraph. The vast majority of those who were involved in the country's response to BSE believed that it was not a threat to human health. In their heart of hearts, they felt that it would never happen. COVID-19 is not the only coronavirus to have emerged this century. In 2003, we reported on severe acute respiratory syndrome, or SARS, which, like COVID-19, was first identified in China. Although there were only ever 4 cases in the United Kingdom, the outbreak was of grave concern. In 2003, I pressed the then Chief Medical Officer, Sir Liam Donaldson, on the country's emergency plans. In contrast to today, the Chief Medical Officer saw it as his duty to subject himself to interviews and spoke to me on Channel 4 News frequently.
It's the question generally as to whether there is enough diagnostic capacity around the country for this very specialist testing. Are we equipped to deal with it?
Well, the main action that needs to be taken on suspecting a case is to get the patient into the right facility so that they're medically cared for and isolated in the right way, and ensure that there can be a minimal risk of further transmission of the disease. But if there are things we can learn from the handling of particular incidents that weren't handled as well as they could, then we will obviously learn them and we'll look into this particular case.
But were these lessons learned? Could we, should we, have heeded the warnings of SARS? Looking back at our reports from that time, 17 years ago, it is remarkable how many similarities there are with the present day.
Severe acute respiratory syndrome is believed to be a type of coronavirus, the sort that causes the common cold. The symptoms include high fever, coughing and difficulty breathing.
This SARS outbreak probably began in China, whose premier has admitted the situation there is grave, after weeks of claiming the situation was under control. Over 60 dead so far here, with rumours of far more cases than officially admitted. The tourist hotspots of Hong Kong are almost deserted. It's no wonder the tourism board's unfortunate advertising slogan, "Hong Kong will take your breath away," has had to be dropped. Outside Asia, Canada is the worst affected by the pneumonia-like virus. Authorities taken aback by the virulence of the disease.
Most of the fatalities have been elderly people weakened by other medical conditions. But that doesn't mean the rest of us can breathe easy.
Quite a lot of young, fit people, including some of the specialist medical staff that looked after these cases, have themselves died of it.
Guangzhou's live animal market is back in business. The local authorities have lifted restrictions on trade in wild animals for the dining table. Most worrying, civet cats are back on the menu. The market's been reopened against the advice of China's own doctors, and in spite of growing evidence that civet cats were the source of the deadly SARS virus that emerged from southern China last year.
In 2005, another agricultural disaster struck, this time in the form of bird flu, the strain H5N1. Initial predictions told British people to expect the worst.
When the pandemic hits, it'll hit hard. The government is making plans based on some stark assumptions. 25% of the population will get sick. Britain will be in the grip of the flu for 12 weeks or so, and 50,000 will be killed.
We can't be absolutely sure how many people will die. The figure that we're working on for the United Kingdom pandemic flu plan is for 50,000. But it might be a higher figure than that, and obviously we want to make our contingency plans to predict the worst.
The H5N1 bird flu virus in Southeast Asia is the most likely source of a flu pandemic, though it's not yet adapted to spread from human to human. At the moment, it is a killer. 60 dead so far, over half the people it's infected.
Channel 4 News watched on as the virus made its way through Southeast Asia into Hungary, and in 2007, finally, ending up on a farm in Suffolk.
An unusual number of deaths on this organic free-range poultry farm led vets to alert DEFRA. Even before the results were back, Gressingham Foods began culling the 6,500 Christmas turkeys, geese and ducks on this farm. Hours later, it was confirmed they were infected with the virulent H5N1 strain of bird flu, the strain that can infect and kill humans. The confirmation means poultry farms inside the 10-kilometre surveillance zone are locked down. No movement of poultry or poultry products. In the wider Suffolk and Norfolk zone, free-range birds must be confined and birds can't be moved outside the area. Nationwide, bird gatherings such as pigeon races are banned.
200,000 birds were eventually culled, but thankfully no human cases were ever confirmed in the United Kingdom. Then in 2009, we were there again with swine flu, a new zoonotic disease, but many of the same questions, this time born out of a popular British travel destination, Mexico. The government was insistent that Britain was prepared with stockpiles of antiviral drugs, but soon enough, case numbers rose and so did the death toll.
What's worrying public health officials most about Mexican swine flu is that the virus could be spreading about as fast as news of the outbreak.
Now it's reached Britain. In the last hour, it has been confirmed that 2 people in hospital in Scotland have tested positively for the potentially deadly swine flu.
Travellers are returning from Mexico apace, but the queues to get there are looking decidedly sparse. Today, Thomas Cook cancelled all their flights to Mexico.
I think we should be concerned. What we have here is a virus which has come out from an animal reservoir and is into the human population for the first time, and it's acquired or has the propensity to spread from human to human. So taken together, those are the ingredients for a pandemic virus.
We're not at level 6. We need to be in a state of preparedness at level 4. We are better prepared than any other country in the world, according to the WHO.
The UK is well prepared. The government has stockpiled £500 million worth of antiviral drugs and has enough for half the population.
In the early stages, the danger was that the outbreak might prompt widespread panic. Now the danger is complacency. We want to properly convey the seriousness of the situation without causing alarm.
Since swine flu first appeared, the name of the game has been containment, stopping the virus escaping into the wider world. Today, the World Health Organization finally admitted that game over and declared the first flu pandemic in 40 years.
Swine flu saw Britain with the second highest death count in Europe, 457, which is only a fraction of the tens of thousands killed by COVID-19 here in the United Kingdom. In 2014, the Ebola virus was one of the most terrifying diseases I've ever reported on. Around half the people who caught it died an often painful death.
One of Osman's 3 wives lies desperately ill with Ebola. People here don't understand why nobody's come to help.
Once the outbreak had subsided, there was talk of better planning, large-scale methods of testing in case of another virus outbreak of any kind, as indeed it did with the COVID-19 pandemic this year.
Not containing the outbreak was one of the most high-profile failures in the history of the World Health Organization. By the time it was stamped out, Ebola had killed 11,300 people across West Africa. But today, the WHO celebrated a major triumph, a vaccine that should mean an end to future outbreaks. Towards the end of the outbreak, WHO staff in Guinea worked in some of the most dangerous conditions to vaccinate more than 5,000 people. They used a method called ring vaccination to see if the medicine worked in the shortest space of time, according to the man who designed the trial.
We came up with a completely novel trial design, which meant that what we did is when a case occurred and was notified to the authorities, then we defined a ring around those cases, so they're close contacts and they're contacts of the contacts, and we vaccinated them. And our design was that we vaccinate them either immediately, or we came back and vaccinated them after 21 days. So they acted as a sort of control group.
The big lesson from the sorry tale of Ebola in West Africa is that vaccines for similarly deadly viruses like Marburg and Lassa fever should be developed in advance.
During this coronavirus pandemic, South Korea's containment of the disease has often been applauded. And that's not least because they've suffered at the hands of a similar one before. Back in 2015, they were hit by MERS, a coronavirus which was first identified in Saudi Arabia. Even though only 858 people died globally from MERS-associated illness, more than a third of the people who contracted the virus lost their lives.
Hospitals have been shut, more than 2,000 schools have closed their doors, and 16,000 people have been quarantined. With no known cure and 4 in every 10 cases resulting in death, the virus has had a devastating effect on South Korea. The risk to the general public in the UK remains low. Despite this being a deadly virus, it is hard to catch. The one place it spreads quickly, though, is hospitals.
Fast forward then to the present day, and our world has changed more in just a couple of months than it has over the many years I've reported the news. When I went to Iran in February this year to cover their elections, it soon became clear that politics wasn't going to be the story. Iran was one of the first countries outside China to suffer terribly from COVID-19, and we were there in amongst it all as it was happening. The masks begin to appear. Yes, Iran too has an outbreak, and precautions are beginning to be taken. The health ministry confirms there have been 8 deaths in Iran. This being Iran, conspiracy theories abound, even about where it came from.
It is bought by America.
You don't have any evidence that America made?
No, it is made by America. And after that...
But it happened in China?
They put in China.
In the square, I heard a boy say even the horses are wearing masks. But it's feed time. In truth, it's not the coronavirus outbreak that worries the drivers, but the collapse of tourism provoked by the huge wave of sanctions and the political atmosphere in Iran. I have reported from Iran for 40 years, and I have not found it in such turmoil. The coronavirus has added agony to the economic turmoil of sanctions. Sanctions increased on Friday after Iran was blacklisted for financing terrorism. This led to the bizarre experience of me being interviewed from my home on my own program. Okay, I'm in self-isolation as a result of having been to Iran for the past 4 or 5 days, and I'm therefore not really supposed to congregate with any crowds or go anywhere where there may be, people. So that means I'm sitting at home.
You'll be missing us, John, even if it's only mostly happy. Thank you very much, and stay well.
Thanks. And now, because I'm a gentleman of not a very advanced age, but some, I find myself presenting the news from home, something I never imagined was possible. So while I'm sitting here in my living room, fit as a fiddle, doing my small bit in the fight against the coronavirus, as so many of us are, do join me again for some more memories of history in the making, as witnessed through the lens of a television news camera. Who said Jon Snow knows nothing? See you soon.